You're listening to Health Professional Radio with Wayne Bucklar. My guest today joins me from Sydney in Australia. It's Dr. Craig Erskine-Smith. Craig is the CEO of Erskine Dental and Erskine Oral Care. Craig, welcome to Health Professional Radio.
Yes, good morning, Wayne.
Now, Craig, when I look at the name of your firm and it says it's, Erskine Dental, I'm inclined to think of a suburban dental practice with, 3 receptionists and a dentist and a waiting room, but you're a little bit different to that. Tell us a little more about your business.
Yes, well, Erskine Dental used to be what you just described, but we've moved on now to where we're a large multi-million-dollar company with offices in America and England, and we have the market-leading product in Australia in our category called Piksters, which is an interdental brush made for cleaning in the gaps between the teeth. A bit like floss, but a lot easier, particularly for people that aren't particularly dexterous with two hands. They can usually use one hand and use an interdental brush a lot easier than they can use floss. So that's sort of like the core of our business is interdental brushes, but we have several hundred other dental products that we sell to dentists throughout Australia, many of which we import and many of which we now manufacture. And we're going more and more into manufacturing our own patented products. Because I was a dentist for 35 years, I did notice quite a few problems at the clinical coalface, and I'm lucky enough now to be in a situation where I can actually see what those problems are and I can do something about it, which is a very satisfying feeling to be able to make a product, for example, that addresses a problem and fixes something up that no one else has done before.
And I noticed, Craig, on your website, Piksters.com, that there is an e-commerce, a consumer e-commerce element to it. So people who may be listening to us who are not in Australia can access off Piksters.com that range of products if they want to, I assume.
Yes, that's right. We have an on-store website which is getting bigger and better by the minute. And I would hope by February we'll have a vast array of new toothbrushes, and particularly relevant to your audience would be the ones with the very large grips so that it's very comfortable and easy to hold.
Yes, now I was keen to talk to you about those because about 95% of our audience are clinicians of one sort or other. We don't get a lot of dentists listening, I'm not sure why, but we do get a lot of people out of aged care, and I know you've been developing these toothbrushes and that are patented, I gather, but custom designed for people who don't have great control of their dexterity. Tell us about them in some detail.
Yes, well, we took the view many years ago that Piksters were a great little cute thing for people that only want to use one hand to clean their teeth instead of two like you have to with floss. And then we got a dental hygienist came up to me at an exhibition and said, have you got an extension handle that you can use with this? And I said, no, I don't, but now you say it, I think I should have one. And that started about 4 years ago, this whole chain of developing things that are good for people that have a bit of arthritis or are elderly. And so we made this little extension handle. And then when we were designing our toothbrushes, we thought, what about if we could make the Pikster fit into the end of the toothbrush instead of a toothbrush head? And so we've done that, and we now have an ability now to put an interdental brush or anything else into a proper toothbrush handle. That's the interdental side of things. But the bigger market is just general purpose toothbrushes. So we thought, let's make some nice, comfortable, big, chunky handles. And because I was a dentist, we had some fantastic instruments in dentistry that were rather large and chunky. We called them elevators, and Warwick James and all sorts of exotic names that we have. Anyway, I modelled some of my toothbrush handles on some of these chunky, large dental instruments that we use for extracting teeth. And look, I don't know how they're going to go. They may not set the world on fire, but we're going to put them out there and just see what happens. But they've got very comfortable rubber on them as well. It's slightly tacky. So given the tackiness of the rubber and the size of the handle, you only have to exert about half the muscular force to hold this brush. And then you get a good grip without having to squeeze too hard. And that means people can clean their teeth comfortably and properly without having pain of squeezing something.
It is interesting, Craig, that, you think of a toothbrush and it's a bit like thinking of a mousetrap. There can't be a better mousetrap invented because every possible variation of mousetraps has been invented. And you think, well, I think a little bit that way about toothbrushes. You think, oh, this has been looked at 1,000 times over. But as you've been talking, I've been sitting here thinking, that's true, something that was a bit tacky and that was a bit bigger than normal it would be easier to hang on to, and it would work with wet hands. So we wish you well with that product range.
Oh, thanks, Brian. Yeah, we've got our fingers crossed, and we'll be sending all the dentists in Australia a little gift box of that. And if any of your listeners are overseas and they want to get onto that, stay tuned. In about February, you'll be able to order it on the website.
I'm sure you'll have some interest. Craig, my favourite question in every interview is about misconceptions. In every business, in every industry, there's always a misconception. And in your business, what's the biggest misconception amongst your customers, clients, patients that drives you nuts and keeps you awake at night?
Oh, geez, I'm just battling at you asking this, thinking, what can I answer this question? Oh, misconceptions. Geez, to be honest, Wayne, we don't have too many people, because I'm pretty well known in Australia as being the dentist who became the dental supply company kind of guy, and the gadget and mad professor and dentist type person. So most people sort of know of me because I've done quite a few lectures around Australia. So we don't have too many problems, I hate to say it, in that regard.
That in itself is a good problem to have, isn't it, when you don't have enough problems?
Yeah. Well, we've got enough problems in terms of getting ideas and making them, because, the manufacturing process is not for the faint-hearted. And just to do a patent, for example, we have lots of patents, and they're like $150,000 per patent for the first 4 years. They're very expensive. And that's not a tax deduction either way. You've got to write them off over 20 years. So they're ridiculously expensive and hard to do. The big challenge we have is just getting our products out of my head and onto the shelves of the wherever, or into the dental clinics or the shelves of the pharmacies. So we do have plenty of challenges, and it's not all plain sailing. But no, we don't have too many misconceptions about our business, I think, other than people just think we just make Piksters, and I think maybe they'll find out next few years that we are much more than an interdental brush. We are a full oral care company. We got all sorts of stuff.
And that'll be a nice message for people to get, and hopefully there won't be too many people like me who thought of dental practices when I saw the name.
Well, yes, that's the thing. In the old days, you couldn't have a practice called Erskine Dental. You had to be, Joe Blogg's DDS or whatever.
Yes.
But now the corporatisation and the advertising changes have meant that Erskine Dental can be a dental practice, or it can be a dental company. And but everybody in Australia, we've been around 23 years in Australia, so everybody knows Erskine Dental as a dental company rather than as a practice. That's why we've gone Erskine Oral Care with our Woolworths and Coles type and pharmacy type products. Our big ticket sort of products we trade as Erskine Oral Care, so there's no confusion there at all, hopefully. Craig,
I do appreciate your time today. I realise you're a busy man. So thank you for joining us on Health Professional Radio today.
Well, a pleasure, Wayne. Nice to talk to you, and let's do it again sometime.
We'll do that after January when the range is released worldwide.
Okay.
If you just missed my conversation, I've been in conversation with Dr. Craig Erskine-Smith, BDS. Now, Craig's the CEO of Erskine Dental and Erskine Oral Care, and we've had a fascinating conversation about a range of dental products, particularly of relevance in the aged care sector. If you've missed my conversation, the good news is we have a transcript on our website at www.hpr.fm, and you can also listen to the archived audio of the interview on both YouTube and SoundCloud. My name is Wayne Bucklar. You're listening to Health Professional Radio.